Lyme disease is a very problematic condition once you are infected. Not only is the diagnosis very difficult, and there are not really a lot of good standardization of testing that's absolute, but the recovery is even more challenging. This is Dr. Lam from drlam.com. Now, I want to talk to you a little bit about how adrenal fatigue and Lyme plays together with each other. Oftentimes, I would see many people come in with Lyme disease and a long history of being on antibiotics and trying to get better. But despite the most aggressive and the most well-intentioned doctors to cure the Lyme never quite goes away. Oftentimes, even though there may be a temporary improvement and the acute Lyme is resolved, the body is in a state of disrepair. It's almost like the body is not happy, and the body is always undergoing a slow-grade toxic attack by underlying infections that nobody can put their finger on. This type of chronic or subclinical or Lyme is very difficult to deal with. And the reason is because they continue to secrete toxins even though their titers are not very high. So the conventional approach would think that, well, medicine is given, the titer's gone down, so the person is cured. But in reality, is that it is not 100%. And if you're young, then you're fine. But usually with age, as the person gets older, these types of chronic symptoms oftentimes kind of resurge and continues to be present. And by wearing the body out with the toxin, it contributes a lot to adrenal fatigue, leading to the adrenal gland that is very weak and is unable to produce the cortisol necessary to fend off the inflammation response caused by the Lyme disease. So understanding this concept is very important because Lyme disease can be seen as an underlying symptoms of adrenal fatigue. Now, what you do with it is a different matter because, as I said earlier, aggressive Lyme treatment, by the time it gets to a chronic situation, usually does not work. So you have to switch gears and allow the body to fight its own battle. And there are ways to do that. But first is to understand that aggressive Lyme treatment, when it gets to a chronic stage, usually does not produce a lot of good results. In fact, it can produce a lot of collateral damage, leading to adrenal crashes and detoxification reactions, and can make the body much weaker than it is when it was first started. So you have to be very careful when there's a history of Lyme disease present, and you have to be recognizing this as a possible symptom of contributing factors to adrenal fatigue. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I've written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.